Disease is an inherited blood disorder that affects about 100,000 people in the United States, including 2,000 right here in the Mid-South. So over the weekend, 150 primary care providers came to Memphis to learn about best practices to care for those suffering with sickle cell. Joining a Better Memphis today is Dr. Sara Day with the University of Tennessee Health Sciences Center and the leader of our sickle cell nursing boot camp, and Yvonne Carrol with St. Jude Children's Research Hospital, which has been fighting sickle cell since day one when the hospital opened way back in the 1960s. So, Ms. Carrol, the African American population makes up 90% of those with sickle cell disease in the United States. First, remind us what sickle cell disease is.
So, as you stated, it's an inherited disorder, and that means that you're born with it. And it is a disorder that affects the red blood cells, and it causes devastating complications. It can cause people to have kidney damage and have to go on dialysis. 10% of children with sickle cell anemia, if they're not treated prophylactically, will have a stroke. You can have bone damage. But most important, people with sickle cell will tell you their quality of life is affected by the excruciating pain that they have.
And it is profound.
It's profound.
Indeed. All right, Dr. Day, UTHSC received a $300,000 grant to work on improving care for patients with sickle cell disease. And part of that was hosting this conference for healthcare providers that was held over the weekend. What was the goal of that conference?
The goal was so many of our patients, once they transfer to adult care, they see a general practitioner, or they actually get a lot of their care in emergency departments. So those the people that are the providers in those areas haven't had training, haven't had extensive education in sickle cell disease. So that's what we wanted to do is, provide education so they can provide quality care. Sickle cell disease is so complex. It's not just pain, as Yvonne just said. I mean, it has complications from head to toe, and believe me, all day was not enough time to discuss every life-threatening complication.
And I know from past research that when a young person or any individual with sickle cell presents at an emergency room especially, and the staff there is not used to dealing with that, it really is quite a difficult time, right?
We see deaths that could have been prevented.
Wow. All right. So, Ms. Yvonne, at the conference you talked about breakthroughs that have not trickled down to primary care providers. What kinds of lessons are healthcare providers learning, and how did they share what they learn with coworkers?
So one of the things that we do, we have nursing boot camp that we bring in people from all over the world, all over the United States and other countries, and we want to teach them, because you think about it, what's the largest portion of the healthcare providers? They're nurses. They spend the most time with patients, and they need to understand how to take care of them. So we bring them here to Memphis to teach them how to take care of people with sickle cell disease. And they go on as train the trainer, and they've gone on and they've taught over 2,500 other healthcare providers how to take care of people with sickle cell disease.
That's remarkable work. So, Dr. Day,
it's a ripple effect.
Yes, indeed. The state of Mississippi has the second highest incidence of sickle cell among infants in the United States, I understand. Why is it important for emergency departments especially to be prepared to serve people in perhaps rural areas to improve treatment plans for sickle cell?
So when they present to the emergency department, most providers, and this is just the way it is, they see pain. They think pain and they don't quite understand these life-threatening complications. Children that present with a high fever, this is an emergency. Every person with sickle cell disease that comes to the emergency room should be classified a level 2, and that means they do not need to sit in the waiting room. They need to be seen right away. The leading cause of death is diagnosis of acute chest syndrome, and that is often just missed, and that's why it's the leading cause of death.
Okay, so it's important to be educated, and that's what you all are all about.
We are.
And St. Jude Children's Research Hospital is known for its breakthrough cancer treatments, but the hospital is also been the largest pediatric sickle cell disease program in this great country. And why is that mission so important to St. Jude?
Oh, it's extremely. It embodies what Danny Thomas wanted to happen. He wanted a hospital that researched catastrophic diseases, and sickle cell can't be more catastrophic. It's also a rare disease, so we classify that as 100,000 or less in the United States. So, but also because of our Good Neighbor program, anybody who lives in the Memphis metropolitan area, St. Jude will take care of them with sickle cell disease. And that's why we have over 900 children with sickle cell disease that St. Jude takes care of.
What a blessing that is to our community. And you know, St. Jude is known for its work in pediatric oncology and fighting cancer, but Danny Thomas did say, and any catastrophic disease that affects children.
That's right.
And so since day one, this has been a focus of many of the researchers that don't get as much focus from people like us, but certainly deserve it, right? And so we're glad you all could represent that.
Well, thank you.
We're grateful to you today. So we've been talking with Dr. Sara Day with the University of Tennessee Health Science Center and Yvonne Carrol with St. Jude Children's Research Hospital about the importance of knowing our stuff when it comes to sickle cell. Thank you so much for
Thank
being
you.
here.
Thank
We
you.
appreciate it.